Hello, my name is Lori Badash. I'm a pelvic health physical therapist at Novant Health, Carolina's Pelvic Health Center. This video is part 2 of a 3-part series with information and tips to help women care for their bodies throughout their pregnancy. The first video discussed the changes a woman's body may experience during pregnancy and included some basic core exercises. This video focuses on advanced exercises to stay fit throughout your pregnancy, as well as being safe during your exercise. Benefits for your baby. When you regularly exercise, it also benefits your unborn baby. Moms who work out tend to have babies with better nervous system development and improved cardiac output. They also tend to deliver babies that have higher response to the environment with higher APGAR scores at birth. These babies begin sleeping through the night sooner and exhibit improved mental performance. So you can rest assured knowing there are also benefits for your unborn baby as you exercise. Benefits for you. Studies show that women who exercise during pregnancy afterwards maintain a healthy body weight and avoid excess fat storage. They have improved sleep quality, have fewer complaints of neck and back pain. They tend to have reduced stress response and less body image issues. Their labor tends to be less intensive with fewer complications, and they tend to have a quicker recovery from the whole process of the pregnancy and delivery. These women also go through fewer cesarean deliveries and have the least amount of prenatal issues, including preeclampsia and gestational diabetes. So as you can see, there is no reason not to try exercise. Precautions and guidelines. Remember, you should always check with your obstetrician before starting a new exercise program during your pregnancy. This is especially true if you have not previously been exercising. You want to make sure your body can handle the additional stresses exercise will have on your system. General guidelines for exercise during pregnancy. During your workout, your target heart rate should be between 65 and 85% of your maximum heart rate. In simple terms, this means you should be able to carry on a conversation while exercising. If you are winded, you are working too hard and you need to slow down. Because your body is experiencing many changes with your ligaments becoming looser, you should avoid any activities that require bouncing or jerking movements. You should also avoid sharp twisting motions or any type of vigorous stretching of your hips, like deep lunges or splits. You should avoid lying on your back for more than 3 minutes to maintain good circulation to the baby. Always listen to your body and keep your exertion level moderate. Do not exercise when fatigued. It is easy to overwork yourself, especially if you have not been exercising regularly before you became pregnant. Be sure to stay hydrated by drinking liquids before, during, and after exercise. Your body has more fluid requirements than your unpregnant body. Signs and symptoms to stop exercising. If you experience extreme fatigue, vaginal bleeding, chest pain, muscle weakness, dizziness, headache, amniotic fluid leakage, or you notice decreased fetal movements, you should stop exercising immediately. Be aware that the baby may drift off to sleep during your body's rhythmic movements when you walk, but they should start moving again when you stop. Avoid exercise that requires significant balance challenges. This could cause trauma to your abdomen if you were to fall. First, we will talk about cardio exercises. If you are currently an exercising person, you may continue to do so as long as you are comfortable. Although it is not advisable to start a running program during your pregnancy, running is okay for the first 6 months so long as you are not feeling pain or extreme fatigue. Do not push through discomfort as you run, since this may disrupt the natural stability changes your body is making as your pregnancy progresses. Remember, walking is just as good as running and is much safer for mom and baby with less stress through your pelvic girdle joints. Cardio machines are much safer. Stationary cycling and ellipticals are preferred ways to exercise as they reduce the danger from falls or trauma, as long as you keep your form steady and avoid excessive fatigue. If you are going to do a walking program, make sure you walk at a brisk pace to keep your body and your core activated. Slow walking can be harder on your joints because it causes too much weight shift and can result in an injury to your pelvic girdle. An interval program of moderate paced walking mixed with standing rest is a very good way to start. If you are new to cardio exercises, You should exercise for a few minutes, rest, and repeat at comfortable intervals. Use your body's fatigue and exertion signs if you are not an experienced exerciser. Next, we will talk about the strengthening phase, including exercises for your core and abdominal muscles. The goal of your abdominal and core care is to keep the pelvic girdle and your spine pulled in to prevent overstretching of the muscles and ligaments in the abdominal wall, the pelvic girdle, and the pelvic floor. Overloaded ligaments can lead to pelvic girdle pain syndromes that can last beyond the delivery. You should start with a progression for targeting all these areas together. My favorite exercise is called Hug the Baby. You start by getting on your hands and knees. This is known as the quadruped position. You can lower yourself from a chair if you find it difficult to get into this position from standing. Once positioned, gently inhale. As you exhale, imagine your tummy is pulling the baby up close to your spine. Exhale all the way to recruit the abdominal muscles to help you breathe. You will also feel your pelvic floor lift. Hold this exhalation for 5 seconds. Relax, inhale, and release your belly away from your spine. You should feel a small stretch in your abdomen. Repeat the abdominal contraction with the next exhalation. You can squeeze a exercise ball between your thighs to help recruit your core muscles if needed. Your next step is to add some stability challenges. From the quadruped position, start with hugging the baby, hold, and then raise one arm forward in front of you. Hold for 3 to 5 seconds, and then return to your hands and knees position. Repeat with the other arm. This will help strengthen your upper back and your spine. Now let's add a challenge for your gluteals and your buttock muscles. While still in quadruped, start with hugging the baby in your abdominal wall, stabilize, and then slide one leg straight out behind you. Hold this position for 5 seconds and then slide your knee back in underneath. This will help strengthen your gluteals, which are needed to help hold your pelvis together. Once you feel coordinated, you can repeat with raising the leg from the floor, holding stable for 5 seconds. The next exercise is a plank progression. This is a very important exercise to target all the core muscles at the same time. You start on your hands and knees with your hands a little further forward than the quadruped position. Lean your pelvis forward and stop when your pelvis is in a straight line with your shoulder. Hold this position. Hold your belly up off the floor while gently breathing in and out. Press back into a supported kneeling position when you need a break. Do this for 5 to 10 seconds and progress to 10 reps. Do not allow your back to sway, as this will cause injury to your spine. Small movements with good form are the key to gaining benefits from this exercise. Hip stabilizers. Next, you're going to position yourself in a side laying position. You want to have your hips stacked on top of each other, and you want to have your bottom knee bent and your top leg straight. Activate your abdominal muscles by hugging the baby. Hold, then lift your leg straight up in the air with your outer ankle bone rising to the ceiling. Slowly lower your leg down. Keep hugging the baby throughout the whole leg raise and release. Repeat 10 times or until you begin to lose your form. You can work until your leg is tired. Do not roll forward or backward for stability. Now we're going to do inner thigh activation. In the same side lying position, keep your bottom leg bent and place a ball or a thick pillow under your top leg. Hug the baby position in your abdominal wall and gently press your top leg into the ball or pillow downward. This will activate your inner thigh and your pelvic floor muscles. Maintain your position by avoiding rolling forward and backward during the presses. You can continue until you are fatigued in that inner thigh. Next, we'll talk about upper body exercises. For this position, you can either use a chair, or if you're in good condition, you can use a stability ball. You will need resistance tubing or exercise bands for resistance. Sitting at the edge of your chair, begin by hugging the baby. Reach your arms straight out in front of you. As you exhale, bring your arms out to the sides, pulling your arms apart diagonally, and then slowly returning to center. Change to the opposite direction, and you can alternate right and left. Always keep hugging the baby throughout the whole movement to maintain your core stabilization. When you feel confident, you can reach overhead and pull the band to the sides of your head for additional shoulder strengthening. Try to perform each of these directions 10 times. Be sure to use slow, controlled movements with easy breathing while hugging the baby through the whole movement. Next, we're going to move on to functional movements and standing. For the next progression of exercises, we're still going to be hugging the baby because we always want to keep that stable position. First, we'll do mini squats. Okay? We'll keep your legs hip width apart. And what you're going to do is bend your knees and press your buttocks backwards, but only go halfway down. Return back to standing. Repeat several times, always maintaining your core stability. Mini lunges. Step 1 foot forward, approximately 15 inches, and bend both knees. Return to standing. Make sure you're always hugging the baby the entire time to stabilize your core. I also want to add a few balance challenges. So you can stand against the wall or against the table, hug the baby in, practice standing with your eyes closed and your feet either narrow or in a tandem stance. Practice catching yourself with your ankles so you learn to feel more stable. Now that you've done all these exercises for stabilizing the core, it's nice to stretch out and to relax. The first position is going to be a child's pose. So we will again start in the quadruped position. Let your knees spread out to the side. Slowly hug the baby and press your buttocks towards your heels. If you can, slowly lower your head and walk your hands out in front of you. Take several deep breaths in this child's pose and then slowly reverse the process to come back out. Seated side stretch. This stretch feels really good after you finish exercising your core. You want to sit in a chair toward the side edge and hold the opposite side with your hand. Slowly slide your right leg backwards along the side of the chair. As you stabilize, raise your right arm over your head, slightly bend to the left for a total body stretch along your right side. Hold this stretch for 3 to 4 breaths. Do not overstretch and ensure that you stay comfortable during this whole position. Repeat the movement to the other side as many times as you'd like to help you relax. Remember, whether this is your first or your 4th child, every pregnant mom can reap the benefits of gentle exercise. Thank you for watching our video about pregnancy exercise tips and tactics. We hope you will feel inspired to stay in shape as you prepare to be a mom. If you have any questions, pelvic girdle issues, or pain syndromes, please give us a call to schedule an appointment with a pelvic specialist or a pelvic physical therapist to help.